How does a registered nurse delegate care of a patient to a healthcare assistant? A. Delegate his difficult care tasks to the healthcare assistant and remain accountable for the patient. B. Delegate tasks and duties within the other person's scope of competence. Check that they fully understand instruction. C. Delegate care for a physiologically stable patient to the healthcare assistant. D. Delegate accountability to the healthcare assistant. Answer is B. Delegate tasks and duties within the other person's scope of competence. Check that they fully understand instruction. So as a registered nurse, you have to delegate tasks and duties within the scope of competence of healthcare assistant, and you also need to check that the healthcare assistant fully understand the instruction you have given. What position does a nurse adopt when interviewing a client who is in a wheelchair? A. Standing in front of the client. B. Sitting in a chair 2 meters in front of the client. C. Sitting in a chair at 45-degree angle of a client. D. Sitting in a chair behind the client. Answer is B. Sitting in a chair 2 meters in front of the client. How does a senior nurse manage a potential risk to patient safety when new nurse has made several errors when delivering a patient care? A. Check who is responsible for the nurse's induction and discipline them for ineffective staff induction. B. Tell the nursing team to manage the issue themselves. They are all professional and must learn to work as a team. C. Reprimand the nurse publicly for failing to deliver safe care which is putting patient at risk. D. Talk to the nurse, express concern, discuss their need, offer additional support and supervision to develop their competence and confidence. The answer is D. Talk to the nurse, express concern, discuss their need, offer additional support and supervision to develop their competence and confidence. What is the role of the NMC? A. To represent or campaign on behalf of nurses and midwives. B. To regulate hospital or other health care setting in the UK. C. To regulate healthcare assistant. D. To regulate nurses and midwives in the UK to protect the public. Answer is D. To regulate nurses and midwives in the UK to protect the public. What is clinical supervision? A. A formal process of professional support and learning which enables individual practitioner to develop knowledge, competence and assume responsibility for their own practice. B. An opportunity to moan about the job to someone who understands the pressure of work. C. An opportunity to discuss work issues that are of concern and issues around their own professional development. D. A break from the ward or community once a month, discuss social activities, family and holidays with a supervisor. Answer is A formal process of professional support and learning which enables individual practitioner to develop knowledge, competence and assume responsibility for their own practice. A relative of a confused patient in the care home has asked that bed rails be attached to a bed to prevent them getting out of bed. As they have these at home, what approach does a nurse take? A. Inform the relative that they do not agree with the bed rail use and decline the request. B. Accept the details from the relative and arrange for the rail to be fitted. C. Request risk assessment to be carried out by a competent person taking into account all the factors. D. Remove the bed and provide a mattress on the floor. Answer is C. Request risk assessment to be carried out by a competent person taking into account all factors. So if the nurse is not competent to do risk assessment, they need to request to the competent person for the risk assessment and identify whether patient is in the risk of fall or anything else. So based on that, the decision need to be taken. Nurse has been diagnosed with chickenpox and has been advised not to attend a planned study day. Why has this advice been given? A. To prevent infection to other students. B. To prevent irritation of the spots. C. To prevent the condition worsening. D. To prevent cross-infection of the public. Answer is D. To prevent cross-infection of the public. A client's mother gives a nurse a birthday card which contains some money. What is the nurse's response? A. Put the money in the war fund. B. Thanks the mother. C. Return the money to the mother. D. Buy a book for personal use and show the mother. Answer is C. Return the money to the mother. What actions does a community nurse take when they observe a student using a mobile phone to send a text message during an initial assessment in a patient home? A. Say nothing to the student, better report their behavior to their personal academic tutor. B. Ask the student to put the phone away and refocus them on the patient assessment. Discuss strategies for communicating effectively during a patient assessment. C. Ask the student to put the phone away and refocus them on the patient assessment. D. Wait until they leave the patient home and speak to the student about their behavior. Answer is B. Ask the student to put the phone away and refocus them on the patient assessment. Discuss strategies for communicating effectively during a patient assessment. A nurse needs to inform a patient of their blood test result, but the patient is in the bathroom. What is their approach? A. Ask the ward clerk to pass on the results. B. Wait until there is an opportunity to speak privately to the patient. C. Leave the results by the patient bed for them. D. Call the results out through the bathroom door. Answer is B. Wait until there is an opportunity to speak privately to the patient. A patient is given details on several diagnostic tests and treatment to consider. What is this called? A. Informed care. B. Informed practice. C. Informed choice. D. Informed consent. Answer is C. Informed choice. How does a nurse meet the spiritual needs of their patients? A. Respond appropriately to the patient's spiritual needs and refer to another source of support if required. B. Follow the family's expressed wishes regarding spiritual care. C. Use their own spiritual beliefs to support and enhance patient spiritual care. D. Overtly offer spiritual care to all patients to ensure holistic nursing care is given and recovery is promoted. So the answer is A. Respond appropriately to the patient's spiritual needs and refer to another source of support if required. What factor needs to be taken into account when assessing safe staffing level? A. Age range. B. Gender balance. C. Skill mix. D. Contracted hour. Answer is C. Skill mix. From the following, when should feedback be offered to a newly qualified nurse? A. Continually. B. After the end of the shift. C. Biannually. D. When they are on leave. Answer is A. Continually. A patient on a unit is upset that they cannot make a contribution in a ward meeting due to their speech impediment. How does the nurse respond? A. Include them in the meeting, allowing time to speak. B. Include them in the meeting but ask them not to have any input. C. Include them in the meeting with the writing pad and pen to use to make a suggestion. D. Leave them out of the meeting but tell them afterward what was said. Answer is C. So even the patient is having difficulty in speaking, patient should be included in the meeting, but you need to think about the other option for the patient to make them contribute in the meeting so that the writing pad and pen can be given them to make suggestions. A team leader implements a change in practice in an area of work. How do they demonstrate its effectiveness? A. Once the change is embedded, ask stop if they are happy with the change and if it has made a difference. B. Provide evidence of the improvement through the regular audit and feedback to the team and wider organization. C. The evidence from the research demonstrate the need for a change in practice. D. Everyone knew that the change was necessary and that it needed to happen, so no evaluation need to be made. Answer is B. Provide evidence of the improvement through the regular audit and feedback to the team and wider organization. Showing understanding of what has been said by repeating key points back to the patient is called A. Active listening. B. Active lifestyle. C. Active labor. D. Active learning. Answer is A. Active listening. A person with a mild learning disability has been prescribed an inhaler. How does a nurse teach them to use their inhaler effectively? A. Let them try using it and see how they get on. B. Read the leaflet to them. C. Demonstrate how to use the inhaler to them. D. Send them to the nurse at the doctor's surgery. Answer is C. Demonstrate how to use the inhaler to them. A patient is becoming verbally aggressive towards their nurse. What action does the nurse take? A. Tell the patient to speak to the manager, as nursing staff do not deal with the conflict in their role. B. Address the person politely, maintain eye contact, and paraphrase what has been said. C. Listen to what the patient has to say, then walk away quickly without saying anything. D. Ask the patient to write everything in an email and send it to the complaint department. Answer is B. So the nurse need to address the person politely and she need to maintain eye contact with the patient whenever she is talking to the patient and paraphrase what has been said by the patient. Where is the gastrostomy feeding port inserted? A. The throat. B. The bowel. C. The stomach. D. The bladder. Answer is C. The stomach. Christina cannot get herself a drink because of her disability. Her carer only give her drinks 3 times a day, so she does not wet herself. What type of abuse is this? A. Physical abuse. B. Institutional abuse. C. Neglect. D. Sexual abuse. Answer is C. Neglect. Preoperative fasting of patient before a general anesthesia. A. Prevent nausea. B. Reduce the risk of reflux and inhalation of the gastric contents. C. Reduce the risk of patient vomiting. D. Prevent the patient gagging. Answer is B. Reduce the risk of reflux and inhalation of the gastric content. When writing in a patient notes, a nurse makes a mistake. What action is taken to correct the entry? A. Cross out with a single line, date and the changes. B. Cross out in red pen and write another entry. C. Cross out with a single line, rewrite the entry on a new page. D. Cross out the entry and ask her colleagues to write it correctly. Answer is A. Cross out with a single line, date and the changes. What approach does a nurse take when working with a patient and carers from different cultures? A. Ask the patient how they would like to be cared for and encourage them to express their personal culture needs. B. It depends on each culture. Some culture needs cannot be met. C. Treat everyone as you would like to be treated. D. Encourage the patient to adapt to the care environment and get to know how things are done. Answer is A. Ask the patient how they would like to be cared for and encourage them to express their personal culture need. A doctor asks the nurse to take a lactate on a decreasing patient. How does the nurse get this measurement? A. Via venous blood gas. B. Via full blood count. C. Via urine sample. D. Via urea and electrolyte blood test. Answer is A. Via venous blood gas. Thank you for watching. If you like my video, please like it, and if you are new to my channel, please subscribe to my channel and press the bell icon to get more videos. Keep watching and supporting. Thank you.